Hello everyone, today's video is another Q&A video. I'm going to be talking about ozone for autoimmune conditions, talking about mycotoxin levels on a urine mycotoxin test, and talking about how much salt one can add to their water if treating a condition like POTS or something like that. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need any medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thank you in advance for taking a second to do that. So starting at I'll go in the same order that I mentioned these in. So the first question here is, what volume of ozone do you typically use for your treatments of autoimmune conditions? So thank you for the question. I had posted a video 2 years ago called Ozone Therapy for Autoimmune Disease. So that's what this question was posted on. That's the video was posted on. Some clinicians out there talk about starting with a really low volume of ozone and gradually building it up, because ozone is works as through what's called a hormetic effect in the body. A hormetic effect, very briefly, I've talked about this in other videos, and so I won't beleaguer the point here, but a hormetic effect is when we apply some type of stressor to the body, and then the body responds to that stressor with an overall healthful reaction. Great example would be, you go into a cold plunge, your body's like, what the heck are you trying to do to me? You're trying to freeze my whatever pants off or something. Anyways, usually not wearing pants in a cold plunge, but anyways, and then so the body's like really stressed about it. But then when you get out of the cold plunge, then your energy levels go up, your endorphins go up, your mood improves, you have better blood flow overall, all these positive health outcomes from being in that stressful situation. So with ozone, it's an oxidative therapy, and so it's the body's like, what are you trying to do to me? You're putting all these oxidants, this oxidative substance in the body into me. Body speaking here, but then it comes back stronger than before by making more antioxidants, reducing overall inflammation levels in the body, stimulating the immune system to work more potently, has mitochondrial enhancing effects, nitric oxide releasing effects, etc., etc. So with some clinicians, they recommend starting at a very low concentration of ozone, like maybe something in the realm of maybe like 2,500 micrograms of ozone, let's say, and so it'd be, say, 50 milliliters of 50 gamma or 50 microgram per milliliter ozone, and starting with that and then gradually increasing from there. And the idea there is that in the presence of autoimmunity, there is, when you look at the research literature on ozone, it leads to a lot of cytokines being elevated, cytokines being these cell signaling molecules, and some of those cytokines are pro-inflammatory. So at first blush, it's like, oh my gosh, ozone's causing an elevation of pro-inflammatory cytokines. We've got to be extra cautious in these autoimmune conditions because there's already too much inflammation afoot. But there's also all these anti-inflammatory cytokines that are produced, and we know from the research literature, when we look at the sort of more primary literature, looking at like petri dish studies and animal studies and whatnot, what's actually happening with their cytokines, also looking at human studies, we're looking at their cytokines, but then also looking at clinical outcome studies. Across the board, with very, very little exception, ozone has this net anti-inflammatory effect, this net immunomodulating effect. So it's just overall very regulating for the body, very supportive. And so while I very much respect the experiences and thoughts and opinions of other clinicians out there, I just really haven't seen ozone have a pro-inflammatory effect. I've had a handful of patients over the years out of the, thousands of patients that we've worked with who have worked with the thousands of treatments we've worked with intravenous ozone therapy over time. It's very, very, very rare to see a flare-up from that, even in folks with autoimmune conditions. Normally, we just work with a full-strength treatment of ozone, which is typically somewhere in the realm of around 12,500 micrograms of ozone per treatment. So there might be some exceptions to that, and I do have one patient I can think of off the top of my head, very, very, very sensitive patient, very sensitive to oral supplements, etc. We started with some super, super low dose ozone, I think something in the realm of maybe 1,200 micrograms or something like that, and it actually caused a temporary flare-up. So we dropped it down to maybe like 650 micrograms, like a baby dose of ozone, and that really helped. And it really helped to clear up a flare that patient was in. And so every rule is made to be broken, maybe not every rule, but a lot of them. There's exceptions to every rule at the very least. And so not saying that's true by and large, but for the most part, we just do what I would call kind of full strength, full dose ozone for autoimmune conditions. There is 10-pass ozone, which is basically like doing 10 IV ozone treatments in one. We don't do that at our clinic, and I don't really have any clinical experience. I have no direct clinical experience with that. I have some patients who have sought out those treatments at other clinics, but I can't really speak to that. So maybe 10-pass ozone or 3-pass or 6-pass ozone, maybe that would be too much, but with single pass, just like regular old IV ozone, that's what I've seen. So thank you for the question. The next one here is about mycotoxins, and unfortunately, anyways, the page is not loading on my YouTube channel with that specific question, but if memory serves, it was something like, if a mycotox comes back with a level of ochratoxin between 20 and 50, could that just be from consuming food, or I think that was the question. So if the person asking the question is watching this video, which I hope you are, because I'm answering it for you, and anyone else who's interested, please let me know if I got that wrong. So with mycotoxins in general, whether it's ochratoxin or oh my gosh, mycophenolic acid or aflatoxin, that's the one I was trying to think of. There are research studies showing that you can absolutely see mycotoxin levels on a urine mycotoxin test from consuming foods that have those mycotoxins in them. And that's why, in my opinion, it's really important to do our very, very best to try to be on a low mycotoxin diet for at least a few days leading up to the urine mycotoxin test, so that we don't get a false positive. Because if I go chow down on a bunch of corn that had a little bit of aflatoxin contamination, and then my mycotox comes back with like, oh my gosh, there's all this aflatoxin, well then that's going to send us on a wild goose chase looking for aspergillus mold, somewhere in the patient's house, or we assume a past exposure or something like that, and it's going to give us a false positive, basically. So that diet prep is really, really important, in my opinion. Urine mycotoxin testing is not perfect, unfortunately. Every year I attend the International Society for Environmentally Acquired Illness, or ICI, and it's an awesome conference, and there's always presentations about mycotoxin testing, and the more years that go by, the more holes we learn about with urine mycotoxin testing. It's no fault of the lab or anything like that. It's just there are different variables that come into how efficiently a patient's detoxifying these mycotoxins, and food contamination and different things like that. So it's not a perfect test. But generally speaking, if I saw a ochratoxin level of 20 to 50 in my practice, I would generally, as long as the patient said like, yes, I followed the dietary prep, I would generally think that that is not something that's related to food. That's a pretty high level, especially like the 50, that's pretty high. And I would generally think that that's something that's clinically relevant related to mold exposure, either current exposure, or there's some mold colonization of the sinuses leading to that ongoing production of mycotoxins. And the last question here is, so I posted a video a year ago, which was about taking binders leading to dehydration. So I must have talked about something to do with salt and water in there, I don't know. But anyways, the question is, how much salt can one add to water? So presuming that it's about, therapeutic amounts, not like, how much on a chemistry level, like, can I add a cup to a cup and how much will it dissolve? I don't know what the saturation point of water is with salt. But in terms of how much salt can one add to water, for my patients, for the most part, it's pretty rare that their daily salt amount that they would add would exceed 1.5 teaspoons. Every once in a while, I'll have a 2-teaspoon patient. I have one patient who takes a couple of tablespoons a day of salt, and that's really, really rare, and something that I've not seen in anybody else except that one patient. So yeah, sometimes folks need a lot of salts in their water to combat some dysautonomia symptoms. But we have to be really cautious with salt in water, because taking high amounts of salt for long periods of time can increase the risk of developing kidney stones. And then, of course, if somebody had high blood pressure, which they'd probably not be taking the salt in that case, but we have to be a little bit cautious with monitoring that. So we do have to be, it's not just a benign thing, taking salt in water. Thank you for the questions. If you have any questions on these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.